Welcome to the DeviceAlliance MedTech Radio Podcast. I'm your host and president of DeviceAlliance, Scott Johnson. Today we are at the MD&West 2021, and I'm here with Dave Saunders, apologies.
That's okay.
CTO and co-founder of Galen Robotics. Dave, thanks for joining us.
Hey, thank you.
So share with our audience, tell us about what you do.
We were formed a few years ago to commercialize some technology that's in ongoing development with Johns Hopkins University. And we are looking at bringing out a surgical robot that is going to mainly center around upper head and neck for the kinds of procedures that it's going to support surgeons with.
All right, so a lot to get into in this conversation here. So very briefly, tell us about your background. How did you get into robotics?
Sure. I'm a lifelong nerd, so it all goes back to childhood and Freud and all that. But I began in the internet industry. In fact, the first .com that I was ever with was in 1989, before we even knew to call them .coms. And so a lot of my professional upbringing, as it were, has been centered around really bringing systems together, but more importantly, bringing people together. For probably the first half of the 1990s, the entire point of internet technology was to actually prove that it was possible to bring just any arbitrary computer together. But once you did that, you were also bringing people together. And as we know today, that obviously has some good sides and bad sides. But I really have found it exciting over the past several decades that what has happened with the internet has really brought together so many people from around the world, and in some cases given people voices who thought that they had none. And about 10 years ago, I came into the medtech industry with my co-founder at Galen Robotics, and we're looking at medical robotics in the same kind of fashion, that the technology is pretty solid. There's a lot of good tried and true robotic technology out there, but it's really about how do we get it into more surgeons' hands? How do we make sure that more people are benefiting from the procedures that these systems are enabling? And also how, especially these days, as even now COVID has really forced a lot of downward pressure on the economics that hospitals can reach into, how do we make sure that they can afford these best tools and technologies, and make sure that the surgeons that want to use these technologies can do so?
So thinking about the landscape as it stands today with robotics in medtech, just kind of a brief history lesson, like when you think of Da Vinci and you think of, the acceleration, it seems to have gone a little slow, as far as if you look at the current landscape now, maybe because of the regulatory hurdles and things of that nature. Is that your assessment as well, that things have been a little bit slower than anticipated with respect to getting robotics in the medtech industry?
It has certainly been a lot of cutting of ice to get as far as we have. Before the Da Vinci, you had a number of experimental robots. There was the Zeus and another one called the Aesop. And these were autonomous robots that actually did things like navigating your skull so that they could do a biopsy needle or something like that very precisely. And navigated brain surgery was really kind of the low-hanging fruit to start the technology, because how you navigate the skull, it's soft tissue inside your skull, but the skull is hard, and so it actually created the environment to really start robotics, because you already had a mechanism that brain surgeons were used to of, okay, we have to hold the skull steady, and here's how we figure out where we're going to go into it, make our incision, and then go in with a navigated needle. And so those technologies started there just to prove that it was possible. And then something like the Da Vinci came along, which was originally developed at SRI International, which is also where a lot of the early internet technology came from. And that was about still allowing surgeons to perform these complex surgeries, but give them tools that took a lot of the maybe this isn't the right word to use, but took a lot of the thinking away from it, in terms of I don't have to think about the mechanics so much, and I can instead focus on the patient anatomy. when you do laparoscopic surgery normally, you're going to inflate the abdomen, you're going to stick rods down into the patient. One of them has a camera on it, and the other one is going to have, clamps or scalpels and things like that. And you basically reach those rods down into the part of the body that you want to do the surgery on. And if you think about it, where it enters the body is your fulcrum, which means that down is now up and left is right. And that's a little confusing. And some of these surgeries involve 4 or 5 of these rods, which means the surgeon who only has 2 hands is having to orchestrate other people reaching over the OR table to hold the other rod steady. They're looking at the camera over here and they're doing the procedure, right? It works, but it's not the greatest environment for doing procedures. And you take something like the Da Vinci and it gives you these great immersive goggles, and so now you're in true VR territory. And these hand controllers and little foot pedals that choose which rod to use at any given time. And now suddenly you can just do these magical motions, and it just simplifies the process of these laparoscopic procedures. And here's how I would characterize it real quick is, it's not about doing the procedure better than a surgeon. It's about making it so easy for so many of these trained surgeons who know mechanically how to do these procedures, but now they all have super rock solid steady hands. They've got a system that's going to orchestrate those rods and everything, all that for them, right? And so now, instead of maybe having a few dozen manual laparoscopic surgeon, you have thousands of Da Vinci surgeons. So if you can increase the population of surgeons by orders of magnitude, you've also increased the patient population that can benefit from these minimally invasive procedures also by orders of magnitude. That's the goal.
Yeah, it's so, before we get on to what the marketplace looks like now, how I've always remembered how I analyze robotic surgery is the 2 biggest benefits would be, one, obviously eliminating micro movements, precision of the tools, and then second, the remote capabilities. Am I understanding correctly? Are those still the 2 best features for robotic surgery, or are there other ones now that are being uncovered that maybe weren't on the horizon a few years ago?
For the robots themselves, I would say those are probably your 2 keystones, right? Holding those instruments rock solid steady is a great thing. When you're doing, say, for example, spine fusion surgery. You're driving these pedicle screws. They have to be placed exactly because you're right there beside the spinal cord, right? So the precision is pretty significant. Here's the problem. You're holding these crazy screwdrivers and your shoulders all twisted like this, and you do one here, and you do one here, and you do one here, and you do like 18 pedicle screws, or maybe 6 or 10, whatever. But it just wears. It's fatiguing. The ergonomics are horrible. It just wears. I've met spine surgeons in their 40s who are retiring because their shoulders are completely shot. Wow. So the robot allows the surgeon to still be in complete control. They plan the procedure. They're the ones taking care of the patient, but now they're directing a piece of technology to do all of these repetitive, fatiguing, lousy ergonomic tasks, and that's a huge win for the surgeon, and it's a huge win for the patient, because it means the performance curve is nice and flat. That's a huge win. Remote control, that comes in different flavors. Some robots are autonomous, so you're going to do a pre-programmed thing on a computer, you're going to register it in the OR, you're going to push a button and stand back while it does its thing. A robot like the Da Vinci is real-time remote control, right? It's not an autonomous robot per se. It's you're doing this stuff, and there are other robots like the technology that I'm working on, where the ergonomics of the procedure don't really lend themselves well to the Da Vinci style of remote control. So instead, what we did was we're holding the instruments that the surgeon would already be holding, and the surgeon and the robot hold it at the same time, and so we feel them move like a Segway feels you lean, and we move the instrument, but we get those benefits of just rock solid stability, and eventually we can also do other kinds of features that can help a surgeon with a specific procedure.
Yeah, so let's stay there for a moment. So
sure.
essentially a robotic hand holding the tool itself, So I always had that understanding, but yours is a little bit different. Like, explain that advantage of how you think about that, because I've always understood it to be a tool holding a scalpel or something else.
Well,
you have a little bit more specifics
the other
there.
robots, they all have end effectors of some sort, right? So they have a cutting instrument or an electrosurgical instrument or a clamp or something like that, but they're usually made by the robotics manufacturers. In my case, like say for example, there are 4 major brands of drills that would be used for either middle ear surgery or brain surgery to open up part of your skull. Our robot right now, again, we're pre-FDA, so this is technology that I'm talking about, but we're able to hold any one of those drills that the surgeon already has. So we can provide all of those benefits, but we're providing it with the tools that you've already purchased.
Gotcha.
And I think at least in terms of getting into the market, that's a real benefit for us. Over time, we'll probably find that there will be certain procedures where surgeons will come back to us and they'll say, gosh, if this instrument was just shaped a little bit differently or whatever, because it's held by a robot, I think you should change the way these standard instruments work. We'll probably go back to some of our partners and have them make Galen-ready instruments.
What does the landscape look like right now? I mean, how many robotic companies are out there in medtech? Because you mentioned COVID obviously created a lot of opportunities, and these robots, they're for procedure specifics, right? So is it just like, are we doing like countless new entrants now? Is there like what's your thoughts on that?
The barrier for entry for making a surgical robot is a little high, just because 1, it's a complex device, and 2, you have the FDA, so there is a lot of regulatory overhead that you have to deal with, and that, I think, limits the potential playground. But at the same time, there's a good 40 or 50 robots on the market today. One of the earliest ones that I think a lot of people are familiar with, of course, is the robot that does your eyes for LASIK surgery. But then you've got the Da Vinci. I think there's like 5, I'm going to be nice and call them Da Vinci wannabes. Let's be hopeful about it. Competition's a great thing, but there are other robots for abdominal laparoscopic surgery coming to market from some of the really big players. Fred Mull, who was one of the founders of Intuitive Surgical, started another robotics company called Auris that makes an amazing robot for doing transoral pulmonary surgery. So actually treating cancer in your lung without having to open your chest. It goes down your mouth. Incredible, incredible technology. And that was purchased by Johnson & Johnson, I guess, shortly before COVID. That was a $5.5 billion acquisition. But a lot of robots out there are dialed into procedures. Think Surgical, which used to be called Robotic, does knees and hips. Zimmer has a thing called the Rosa, knees and hips, and also does biopsy needles for the brain, Mazor knees. So a lot of these robots are actually baked around a specific procedure, and to move them to other parts of the body or to other surgical procedures is, well, my phrase is your mileage may vary. It's not an easy road for a lot of these robots to diversify and change the kind of procedures they're going to do.
Understood.
Yeah.
So with respect to the difficulty, obviously, from the regulatory landscape and all that, well, what are some of the other reasons you feel that it's been a little bit sheepish as far as the growth? Because something like this, it sounds so exciting. It solves so many unmet clinical needs. Yeah. So is it the sheer difficulty of it? Is it the everyone's just kind of being a little bit risk adverse? What's your thoughts on that?
It's kind of a convergence of roads involving the low-hanging fruit technologically, big bones, doing knees, doing hips, doing spine fusion. These are things that not a lot of surgeons are going, oh my gosh, I wish I had a robot to do this particular step of the procedure, right? They're very useful, and the more surgeons that use these robots like the Globus and the Mazor, the more that they find that they really do like them, but it's not that they were screaming for them to begin with. Meanwhile, you've got a lot of soft tissue procedures, otolaryngology, sinus procedures, middle ear procedures. Placing a cochlear implant is incredibly difficult. Where's the technology to help with that? Vocal cord surgery. This is a no mulligan procedure. You slip your hand with, you do this procedure with a 25 to 30 centimeter long instrument pushed down the patient's throat, and the cutting instrument, or the cutting portion of the instrument is at the end of that 25 to 30 centimeter long. Imagine you had a scalpel and you taped it to the end of a chopstick and you're trying to do something precise with that. It's very, very challenging. No technology for it. And also, there are no mulligans. You mess up something called a stapedotomy in middle ear surgery, there's not a lot you can do to repair it. You screw up a cochlear implant, there's no going back. And so there are a lot of procedures where maybe the volumes aren't in a great spot, so the reimbursements are rough. $2 million robot for cochlear implants, not going to happen. The economics aren't there, right? And so it's a little bit of, the technology had to start somewhere, and starting with large navigable bones was the obvious technology choice. Those robots are expensive though, and moving those robots into lower reimbursement procedures where surgeons could really benefit from micro procedures that are, really delicate, really difficult to do, but the reimbursements aren't as awesome as they are in spine or cardiovascular surgery. Now it's tricky, right?
Yeah, to that point, and I'm glad you made those distinctions. Mm-hmm. Are there other, preconceived notions with robotics that you feel that people just they're not quite understanding? I mean, obviously those are all great points, but I mean, we've talked about a lot of that. Are there other, a lot of misconceptions that people have about what robotics can and can't do?
Well, yeah, I mean, right now the robots are driven by a surgeon. So even the autonomous robots, a surgeon is sitting down, doing a pre-surgical plan, and then they're feeding those instructions into a robot to actually do that procedure for you. Robots aren't doing your procedure from the moment you open the person's body to stitching it up at the end. They're doing the parts of a procedure that might be difficult or challenging, but they're often the middle parts, right? The most diversely capable robot out there is the Da Vinci, right? Abdominal, I think I've heard it doing I know that there were experiments done with cochlear implants. They weren't, again, not awesome because the economics don't really justify the expense of that kind of robot for middle ear surgery, but they've tried it, right? So it's a very diversely capable robot, but getting it into the hands of those departments, not so easy.
Yeah, and so with respect to the economies of scale and looking at these things being produced, you had mentioned one of the, I guess for lack of a better word, one of the competitive advantages of Galen Robotics. You want to have an adaptable model that can use instrumentation that's already there. What other competitive advantages do you see to Galen Robotics as far as why did you go forth into this endeavor here?
We're looking at building a platform. And what I mean by that is we want to have a robot that can be the basis for instruments that are customized to a specific procedure. Again, this is all pre-cleared technology, but we're working with a university in Toronto that has built a gizmo that has all of the different end effectors all in one box for doing a cochlear implant. Now, if they built an entire robot around this device, again, you have the problem of the economics aren't going to be there. But if this is a device that can be utilized or delivered by the robot that your department already bought, now this works out a little bit better. And so we're looking at different partners, not only to kind of create what we hope to be the next generation of smart instruments that hang on to a robot and really allow us to tune delivery of technology to departments and their varying economic affordability and that sort of thing. But we're also looking at placing the robot. Our particular technology right now is looking like our cost of goods is low enough, partly actually because of things that we learned here at MD&M, shameless plug, but it's true. We believe that we're coming to market with a robot that is low enough cost for us that we're going to place the robot using a model that I call DSaaS, Digital Surgery as a Service, where we're going to bring the robot in, and then depending on the procedure that you're doing, We'll hook you up with the right instruments that you need. We'll hook you up without any instrument adapters and the drapes and all those sorts of things. And you are paying for the individual procedures. Now, as a platform technology, it wouldn't be as cool if it just stopped there. So where we are then looking to go from a technology standpoint, and again, we're working with a number of research partners at different universities looking into this, is we can then build apps around individual procedures for the robot. Now, that app is maybe only useful to the laryngeal department or to the brain surgery department or whatever, right? So the robot itself becomes basic cable. And these other things become pay-per-view for the departments that need them. And so that makes it possible for us to bring it into departments with a better price point.
I want to get back to that app and then collecting that data, but before we get there, so my assessment would be, I'm a surgeon. Having a robot, it's going to be great. It's going to minimize potential, like I said, mistakes and processes. It seems like a win-win. Is there any resistance to this from the surgeons that you have maybe, I'm sure you've done your market analysis, because I'll tell you about one thing that it was interesting when I was in medical device school. I remember some surgeons being very, very against it because, just the old schoolers, right? Now, the next generation of surgeons, are they looking at this like a total win-win, or is there any pushback at all, or is it like, hey, this is...
There's always the sore thumb, right? There's always those guys. So aside from those guys, who don't really seem to fit any demographic that I can predict, the surgeons are really supportive of technology in the OR. They look at it as, you're bringing me better tools. I will use the best tool for my patients, and they just seem to be all for it. Now, what I do find interesting is that the younger surgeons, they grew up playing video games. They got tablets, they got consoles or whatever. Half of their lives, they've got a score up in the top right of their screen. So the idea of working with the computer is completely natural to them. But where it can also go is, as surgical robots start to collect the data from these procedures, at some point we should be able to give real-time feedback to the surgeon and maybe even give them a real-time assessment score. Now in the United States, imagine if a high score decreased your insurance premiums by some percentage, right? There are lots of benefits for that. And the surgeons, even the older surgeons who play video games to keep their manual dexterity up, they all seem to be open to this idea.
So perfect segue getting into the information, the gathering of this, right? So I've talked with people in industry, and one of the problems that we have from a clinical landscape is that bodies of evidence just do not get aggregated together to create trends, talk to each other. People say, well, this is our data, it's clean, and things of that nature. Now, pivoting here to the information and data collected on these robotics. The robots obviously become smarter. They as they collect this data, what other applications and where do you see that eventually leading to with this aggregated data? Because as you mentioned, hundreds of surgeons using this, it's all speaking together. What does that look like for the industry, and what does that look like for robotics in particular?
Well, let me just give you one example. I've seen research where, based on CT scans of the skull, they're able to, and not an MRI, but a CT scan, they're able to actually find the two facial nerves that run behind the ear in your mastoid bone. Now, one of the big risks, if you ever have middle ear surgery, is it involves about 90 minutes with an 80,000 RPM Dremel tool grinding through 1.5 inches of the hardest bone in the human body to get access to the middle ear. Now, the punchline is there are two incredibly important irreparable nerves embedded in the bone right there behind your ear. And so this is white knuckle territory. The otologists that are doing these drill outs, they're just, they're just constantly watching, and they're holding that drill as tight as they can because 80,000 RPMs. And bone is not solid and consistent. It's got lots of little nooks and crannies, and some spots are soft, some spots are hard. If your drill skipped into a pocket, zipped out of your hand a little bit, called skipping, it could sever one of those nerves. And your patient's gonna wake up either looking like they had a stroke, or they have no sense of smell, and it's an irreparable injury. Now, with enough CT scans, we believe that you should be able to begin to identify where those nerves are, and then you could actually teach the robot what we would call keep-out zones. So that now, instead of having to do like 90 minutes of drilling, partially just because I'm trying to go so slowly so I can be super careful, I now can find those nerves, build keep-out zones around the nerves, and now I can practically go into the middle ear like a plunge router. I could turn 90 minutes of drilling time into 5 minutes of drilling time, theoretically, right?
Yeah.
And that's not just a, oh boy, the hospital shaved an hour off of the OR reservation time, although that is a lot of money.
Yeah.
That also means the patient just spent an hour less under anesthesia. Every minute you're under anesthesia is not a minute that you
Yeah, the healthcare economics are obviously there. Yeah. Now, how does that, let's go back to the apps.
Sure.
So like, now, is this just something specific with Galen, or do you see this app development for things of this nature kind of sprouting up?
I think surgical robotics really lends itself well to this idea. Dr. Russell Taylor, who's at Johns Hopkins, I had the pleasure of working with him. He's the father of surgical robots. And one of the things that he often shares in his talks is this kind of nerdy looking series of loops. And it's what probably most of the people at this convention would understand is an engineering loop, or a control loop, an engineering control loop. And what that basically means is in surgical robots, or even just having a computer as part of your procedure, you have what you know about medicine, you have what you know about patients in general. You have the surgeon's training, and then you have what you know about that patient that's on your bed. If a computer is now in the middle of that information exchange, it can potentially respond to changes in the patient or even look up information from the huge body of knowledge that we've developed over thousands of years and provide real-time assistance to the surgeon. Hey, this person has an abnormal so-and-so. Watch out, danger, danger. In fact, using augmented reality, I'm going to change the color of that part of the anatomy and give you a little bit of a heads-up display, and I'm just going to let you know. Watch out for that, right? That's a computer assisting. And this is why technology, I think, is so great with surgical robotics, because it's not about replacing the surgeon. It's about augmenting and complementing what is great about human beings with what's great about computers. And really kind of bringing, chocolate plus peanut butter is my favorite candy, same kind of thing. So I think there's a lot of potential. I think any surgical robot could potentially bring procedure-specific apps to their surgeons and really be able to cater to surgeons that might differentiate themselves by, I specialize in this particular procedure, that sort of thing. Or I don't know a lot about this procedure, but I'm a surgeon in Nome, Alaska, and I have to do any and all orthopedic procedures, especially when we're all snowed in. So having a computer system that can actually coach me in real time over the shoulder, I'm a surgeon, I know what I'm doing in general, but maybe I don't know the particular ins and outs of this exact procedure, down cold, right? And so I could have a real-time coach over my shoulder, literally helping my hands. That's exciting.
With respect to all these exciting things you're talking about and like so much cool stuff, what do you see as some of the potential pitfalls or dangers moving forward for robotics?
It's not so much the first thing I'll say is one anecdote that Dr. Taylor loves to mention is the biggest risk for a surgical robot is that it does exactly the right thing in the wrong place. So that's always a very important step. How do we make sure that the robot is actually where it's supposed to be, doing what it's supposed to be? And there's a whole issue of governance, and that's part of the software development task. Probably 90% of a surgical robot is the software anyway, right? And so there's a lot of work that has to be done there. But as you move into kind of big data and artificial intelligence, it's tricky. If I want to get, let me give you an example. You go to Google Images and you type cat. How does it know what a cat looks like? It's amazing. It comes up pictures and it's just nothing but cats. Some of the cats are looking away. Some of the cats are, maybe they've got mange or something, so they don't look like a good cat, but it still knows they're cats. Well, so what they did was they just posted on whatever, Twitter, Reddit, these different social media places, said, hey, would you please come to this website and click on cats? And also tell us when we have something that's not a cat. Cat, not a cat, cat, right? So it's super easy to get the public to train something like, how do I detect a cat? When's the last time you logged into a website and it made you read what looked like a bad photocopy from a book? Guess what? You just trained an AI for free for character recognition. And how about the new ones now where it says, click on all the pictures of traffic lights, click on all the pictures of crosswalks. Guess who you're training there for free? It's really hard to do that with surgical robotics. How am I supposed to go to the public and say, please click on all the pictures of an appendix, right? So the training data and the people that I can get to help me provide that initial training inoculation for the robot, way, way smaller. And then for a variety of complex and annoying reasons, data shared between hospitals and universities and research groups, it's
sticky.
It's sticky is the nicest way of putting it. It's a real problem. And potentially for like that study I was talking about where it's attempting to identify and potentially even predict where the facial nerves are in the mastoid bone. I should have potentially, theoretically, access to millions of CT scans of the mastoid bone that are from real patients from the past decades. They exist on somebody's, each individual hospital probably has them in their imaging groups on hard drive or on a backup somewhere. Collecting all those, there's no good way of doing that. That's going to slow AI development a lot.
Well, so let's go to the flip side of the coin. Instead of all the large-scale data that's aggregated, what about the empowered patient? What about my individual data? And let's say I have my dad's family history. Let's say, for example, a propensity potentially for skin cancer, right? Like, how do you see this working out on an individual level? And what are those considerations?
I think our right to privacy is really important, and I think in a lot of ways, and maybe this isn't the answer you're looking for, but I think we've capitulated to giving away a lot of our privacy.
Understatement of the year.
Without even realizing it in some cases. And I think that's a shame because in a lot of ways, I think I read this recently, that it's almost like, what if the car companies had access to all of their natural resources that go into their car parts for free? Information companies have access to all of your information, and they're not compensating you for it, and yet they're benefiting from it to the degree of millions and billions of dollars. We need to see some benefit out of that. We need to see active and beneficial uses of those biometric technologies. If we've got all these collections of DNA, we should see the results. We should see well-publicized results of this is what's happened since we've collected 1 million or 10 million people's fully sequenced DNA, and this is what we've learned about this particular disease, or this is what we've learned about treating this particular disease. That's information that we need to know about. It shouldn't be difficult to find. Some of it is available, but it's not easy to find. Paywalls, articles sometimes only get written if they can also be led by a pithy lead or a pithy clickbait style headline, right? And I understand the economics of the media. That's important too. We want readers, we want traffic, and that's really important. But we need to find a middle ground where we can report on the real benefits of the natural resources that we're giving away to these information companies.
So with respect to everything we've talked about, if you could share one piece of information with the public that they should absolutely be excited about robotics and they should really be thinking about it, if you could give one tagline to everyone out there, what do you want them to walk away from when they think about robotics and medtech?
I think when you have the choice between open surgery and minimally invasive surgery. And I won't go into too many details about open surgery, but you can pick your favorite procedure and look at the open version of it, and then compare that to minimally invasive procedure. You want minimally invasive surgery in probably every case that you can imagine, right? The more minimally invasive a procedure is, that by definition means that the incisions are smaller, there's less trauma to the patient, all really good things, but it makes the procedure more difficult to do. Instruments get longer, your visualization technologies become a little bit more onerous. Because of that, robots help surgeons do what they know how to do, but it flattens that performance curve and it makes it more certain that the surgeon can simply put brain to patient and let the robot help them do it consistently, day in, first procedure of the day, last procedure of the day. That's really what surgical robots are about. When you look at some articles out there, you see these things saying, oh, well, you know, this robot doing this procedure isn't any better than the surgeons doing it. Well, okay, when we're talking about minimally invasive procedures, remember, it's often the most skilled surgeons already that are doing minimally invasive procedures because they're mechanically difficult to do. So comparing the robot to a top surgeon and saying, well, it only does as well as they do, well, okay, I consider that a win. But here's the bigger win, like I mentioned before, how many robotic surgeons are there doing that procedure just as well as how many of these surgeons doing it manually?
Yeah.
Basically, robotic surgery opens access to what used to be procedures that were only being done at teaching hospitals, being done by surgeons that had 6-month waiting lists. It's giving you access to top, best procedures that you might not have had access to 10 years ago. That's a big win.
That's huge. Tell us, what are the next exciting developments for Galen? I know obviously we're pre-FDA, but...
we're filing for FDA in the coming months, and so that's been really exciting. You know, we're also looking beyond that. We are also looking to make a robot that can cover multiple procedures. From a regulatory standpoint, that means it's a roadmap. I mean, so we have to kind of do them one at a time. But I think the way we're looking at rolling robots out there, and the response that we're getting from just conversations that we're having already, it's pretty exciting. It's looking really promising. People are open to that market approach of shifting capital equipment costs to operating costs. And we hope that will translate to a lot of utilization for the robot, which means a lot of patients benefiting from those procedures. And then on our side, it also means we'll have access to a ton of data that we collected ourselves, which will then allow us to start developing really that next generation of apps that are really dialed into individual procedures. So I'm just watching it unroll is a lot of fun.
Well, it'll be exciting to keep a track of your progress.
Thank you so much.
You know, you've been so generous with your time, and one of the things we do on the DeviceAlliance MedTech Radio podcast, we always ask our guests about a book that has inspired them professionally or personally, if you could recommend out there.
Wow.
So I'll put you on the spot here with the same question. Did you have a book that has really impacted your life, professionally, personally?
So many of them. You know, Dune, the entire Dune series, big one for me. Part of it is just about understanding that the long haul is sometimes worth it. That's one of the many messages I think that you can pull out of there. But also for anybody that's dealing with a startup, Crossing the Chasm, which is a much smaller business book, has always been a really big one for me because, you know, no matter how many times you've done a startup, the pitfalls are many, the potholes are many, lots of big rocks in the road in your way, and just knowing that they're going to be there and understanding how to navigate them to the best of your degree is a fun process. And so I guess it's the Crossing the Chasm plus Dune, because you do have to realize that as long as you persevere, there is a better thing out there.
So you're excited about the new, they're doing a new movie, right? The Dune movie, yeah.
I'm cautiously optimistic. They're obviously, the first movie was, entertaining for probably the wrong reasons. So I'm hoping that we're going to see a fantastic Dune movie and the Foundation series, which is another long haul storyline told over thousands of years, which is probably my second favorite book series of all time. And it ties into Asimov's robot series, Daniel Oliva, which is the robot that actually ends up being part of the story the entire thousands of years in the storyline. That's coming on Apple TV, I think, in October. So, yeah.
Well, thank you for being our first science
good stuff
fiction.
To watch on the airport.
Yeah, your first science fiction recommendation we've had on the DeviceAlliance MedTech Radio podcast. So, how can people follow you? Are you active on social media?
I'm on LinkedIn, so it's linkedin.com/in/Nemock, Nemock. And I do share a lot there, and then our website is GalenRobotics.com.
Dave, thank you so much for your time today, sharing all this exciting information with our community. And yeah, we're really looking forward to keeping track of your progress. Wish you best of luck.
Hey, thank you so much.
All right, thanks.